Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County.
The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
ये bet में आया.
我们能够做到.
Podemos hacerlo por todos nosotros.
Idi manandarki sadyam.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste. આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
या ये है all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone.
Especially the most vulnerable.
We're pleased to be joined by Mendocino County Health Officer, Dr. Andy Coren, who'll give us a brief update on the COVID-19 status of our county. After that, we open up to take a few questions from the media concerning the COVID-19 incident. If time allows, we will also take questions from the public. If you are a member of the public, please leave your questions on this video below or in the comment section to the side on YouTube, and we'll address them. Now, beginning with our health update, Dr. Coren, you have our attention.
You're muted, Doc.
Sorry. Thank you, everybody, and welcome. We'll start with the data. The surge is continuing. You can see on the slide at this point that we have seen significantly more cases over the last month, and it went up from 2 weeks ago, but has come down again, now down into the 30s again to 38.4 cases per 100,000 per day. As I said, there was an increase in the last 2 weeks to the low 50s, but that was, I believe, due to the Labor Day surge, and it seems like we may be decreasing again. And this seems to be consistent with the state's trend. So let's take a look at this. On this slide, you can see at the very top, the purple line is the Rural Association of Northern California Health Officers. And this is a group of counties, and we have been leading the state, unfortunately, in the numbers of cases. However, it does seem to be coming down. Mendocino, as you can see in the next line, is orange, and that does clearly seem to be coming down. And then below that are San Joaquin Valley, which is still quite high, but greater Sacramento and Southern California, as well as the Bay Area states, or the Bay Area counties are below that. As we look to the next slide, we can see that since last spring, we have had the highest surge of cases, confirmed cases, here on the left graph, and in blue is more the epidemiological numbers, and the averages are in the black line, which is considerably higher than the state. In terms of deaths, the slide shows only 68 deaths, and that is still exceeding the winter surge. However, in reality, I'm sorry to report that as of now, there have been 80 residents in our county who've passed away from COVID. That is 12 more in the last 14 days. We have had a decrease in the number of people that we've had in our isolation quarantine, but we continue to provide food and shelter for 11 people in those situations who need it, and that has come down since a few weeks ago. Hospitalizations and deaths follow the rise in cases, and as of September 23rd, yesterday, we had 19 people in our hospital. That included 2 from other counties' hospitals, which were full. But also we have 4 Mendocino County residents who are out of the county because they require more care than we have available here. As far as our intensive care unit availability, it is still scarce, and this morning was 18%. I want to just call out the heroic staff throughout the hospitals. They're exhausted from the work that they've been having to do. County Behavioral Health Department has helped them with providing extra beds and transportation for patients in the emergency room who needed mental health placement or transportation. Nearly 89% of people who we have seen hospitalized have been unvaccinated. So it's important to understand that this pandemic is continuing to go on, though it affects some people who are vaccinated. The vast majority are because we have such a high number of people who are unvaccinated. We did see some who passed away who were vaccinated, but their total age range was significantly elevated, and their comorbidities compared to those who were not vaccinated. So COVID treatments with monoclonal antibodies has increased in Mendocino County, and they are being scheduled at Adventist Health Mendocino Coast and Adventist Health Ukiah Valley, and also in Round Valley Indian Health, with more clinics exploring the use of these for outpatients with mild to moderate symptoms and a high risk for progression. Monoclonal antibody is now a scarce resource in California, but we have adequate amounts in Mendocino County. The next slide shows how we're doing as far as vaccinations go. As of the 23rd, yesterday, the state recorded 105,921 doses have been given in Mendocino County. And of those who are eligible, 68.8% of our citizens are fully vaccinated. 78.8% of the eligible population have had at least 1 dose. From an equity perspective, we continue to exceed the state among the lowest resource communities and in the Hispanic population. 91% of our people in quartile 1, the lowest resource community, have been at least partially vaccinated, and that's compared to 76% in the state. In quartile 2, we had exceeded the state, but we have fallen down a little bit. Still 75% are at least partially vaccinated in that group. What's important there is that this is the largest population from an equity perspective in Mendocino County. Among the Hispanic residents, 66% are at least partially vaccinated, compared to 73% of the non-Hispanic whites. This disparity continues, but it has been closing as we move forward. And also using the federal data, we're able to see a little bit better what the Indian community has been able to use, and they have only had 57% who are at least partially vaccinated. And the next slide shows age groups, and those in Mendocino County over 50 years old have caught up to the state. But from 12 to 49-year-old, we are running behind the state. The dark line shows where the state is for fully vaccinated, and the blue shows fully vaccinated, and the light blue shows the partially vaccinated. So when you add the dark blue and the light blue together, you can see what I'm talking about in terms of at least partially vaccinated. It's understandable that the youngest are a little bit behind, not behind the state. They should be up with the state, but they're lower in terms of total numbers. But it's very unfortunate that the 18 to 49-year-old group has fallen so far behind, because it is in this group that the rates of severe infections have been increasing. We will be reaching out to many in our community for whom we have records that do not confirm their second shots within the last 2 months. We think that many of them may actually have had full vaccinations. They really need 2 doses for protection from Delta, but these calls will be a reminder or an opportunity to offer them their final doses of vaccine. Overall, the vaccine demand has decreased again. Third doses for the immune-compromised people are ongoing now through medical providers, the clinics and pharmacies, as well as through the health department. I want to talk next about the boosters, but before I get into the issues of the boosters, I want to review state data on the continuing efficacy of our current vaccines. So if we look at this graph that is based on state data, this shows the rates of cases by vaccination status. So this is cases, and you can see the dark green line are those people who are not completely vaccinated, and the dotted green line are the people who are completely vaccinated. So there's a huge disparity in terms of the numbers of people who are not vaccinated and unfortunately catching COVID. The next slide shows the same data as far as hospitalizations. Again, you can see the people who are unvaccinated are about 8 to 9 times greater than the numbers who have been vaccinated in the dotted blue, in the dashed blue line. Now, the gray area to the right of all these graphs is where the data is not as certain because of reporting delays. So that's just what that gray line means. And the next slide will show the rates of people in the intensive care unit. Again, by vaccine status, you can see the much more severe illnesses of people who have not been vaccinated in the solid, I would call that a red line. And in the dashed red line below, you can see those people who have been in the ICU who have been vaccinated. And again, there is in the range of a 10 times greater number of people who have not been vaccinated who wind up in the intensive care unit. And the final slide shows mortality. And again, the solid red line shows the mortality of people who have not been vaccinated and those who have been vaccinated. Those missing their vaccines are actually over 8 to 10 times greater. So the vaccines are very effective against disease, but also in particular against severe disease, hospitalizations, intensive care unit admissions, and deaths. We have been seeing an increase in cases among vaccinated people because vaccinated people numbers are growing. Unfortunately, this has led to outsized fears about the efficacy of the vaccines. But again, I want to say, and the CDC and the CDPH, all the people who collect this data are continuing to say that the current vaccines continue to be very effective with few exceptions. Fear, unfortunately, that they are failing has stoked the hunger for boosters. And fear has fed those also who are not getting vaccines. But the latter is by far the greatest danger. People must get those vaccines to protect themselves against severe disease. The vaccines are safe and effective, and they're the way back to a normal life. The approval for boosters vaccine has been a bit of a roller coaster in the last few days, and we'll need to await the final CDPH approval in order to be sure how to legally administer these booster shots. At this point, the eligibility that has been approved by CDC Director Walensky includes, and I'm going to just go through these one by one. One, only those who've been given primary Pfizer series, not Moderna and not J&J yet, but they've been given the Pfizer series over 6 months ago. These people are eligible. Over 65 who live in long-term care facilities, nursing homes, should receive the booster. People between 50 and 64 years old with underlying medical conditions should receive the booster vaccine. People between 18 and 49 with underlying medical conditions may receive the booster. And these are generally defined as people with cancer, vascular disease, either heart disease or stroke, diabetes, dementia, chronic lung disease, severe chronic kidney disease or dialysis, and transplant patients, as well as people who have immune compromised diseases or who are on immune suppressing medications. People between 18 and 49 who are at increased risk of exposure and transmission may receive the boosters. These include hospital workers, skilled nursing facility and long-term care facility workers, essential workers, schools, teachers, and staff. The California Department of Public Health will follow the decision, will announce their decision after the Western States Safety Committee announces their decisions and recommendations, and these two are still pending. So although I've outlined it very well, we need to wait for the final approval. In Mendocino County, our Department of Public Health, as well as providers or clinics, along with the pharmacies, will ramp up to meet this demand on top of those who still need first doses, which again, this group remains our top priority because they're unprotected and they are susceptible themselves to the disease, and they will pass it along to others much more easily. This mobilization will entail a large mobilization of our community volunteers, since the hospital workers who have helped so much in the last winter and spring are now very overworked with patients continuing to be in our hospitals. We will be having regular COVID vaccine clinics at our public health centers in Willits, Fort Bragg, and that will be in addition to the regular Friday clinics at Ukiah Fairground. For more detailed information, please go to our website, and Kirk, could you put that up? And follow the link or go directly to vaccines.gov. So if you could show how we walk through this.
Certainly. This is Kirk Ford with DOC Management, and we'll just give you a quick walkthrough of how to see where the best place to get a vaccine is located. So I'm going to pause this slideshow here, and we're going to go to just Google. You can go to vaccine.gov. Oops. No, you can't. We're going to go, well, let's go to the Mendocino County one first. So this is just mendocinocounty.org. And then I've clicked the COVID-19 information, and then we're going to go to the vaccine information, which is the blue bar. You can check out the vaccine clinics. You can also look at some of the other information we have available. If you click on vaccine clinics, you can see all of the clinics that Public Health or OptumServe or one of our partners is sponsoring throughout the county. We have it separated by days, and you can find whichever one you want. And then there's usually information to the side here of how to get involved in that. Either you can sign up at My Turn, or you can do a walk-up of one of those two. Also, one of the things I really liked was this vaccines.gov link that's located on our website, and you can also do it vaccines.gov. It's plural. That's why I missed it. When you click on this, it takes you to a map, and you can put a zip code in here, and you can select which type of vaccine you would like to look for. So since Pfizer's got the booster, we'll look for just Pfizer. Anybody that's got an appointment available in our zip code, and we'll extend it to 50 miles, and we'll search for vaccines. And then it gives us a graph over here on the right, or a chart map that shows all the places that a vaccine is available. Just similar to a regular Google search result, it has different options. We can get at the hospital, Safeway, Rite Aid, Costco, Rite Aid, CVS, more Rite Aids, Mendocino Coast clinics, more Safeways. Pretty much all the pharmacies are going to have the vaccine. So it's a really great way to get there. That's vaccines.gov. If you just went to vaccines.gov, it's going to look like this. All you got to do is click on the blue button here, find COVID vaccine, and you're back to this search bar. That's just a kind of a quick overview of how you can find the closest vaccine to you. And I'll turn it back over to you, Dr. Coren.
Thank you. And then could you also put up the slide for the NCO? Here we go. Okay, so this gives the phone number again for NCO for all the people who might be watching who would like to volunteer. We need plenty of volunteers. Remember that the vaccine protection continues to be very high against severe COVID infection, hospitalization, and death. So the boosters are not a rush. There will be opportunities from, as Kirk said, the health department, clinics, and pharmacies. Moving on, vaccines for the 5 to 11-year-old group will hopefully be approved by mid to late October, and we're in the process of working with the schools and the clinics to provide these vaccines in schools. Finally, we're hearing that Pfizer vaccines for the 6-month to 5-year-olds may be approved in December, and these will be available in providers' offices, both family practitioners and pediatrics, who are trusted by children and their parents as the best prepared to give vaccines to this age group. Little update on the schools. To date, we have no outbreaks in Mendocino County. We have had people suspect and complain that there may be contact, but our contact investigation and tracing team have been able to show that these cases have been brought into the school with infection, usually from a family member, a party, or some travel or event that was attended by the student. We also have increased testing there, and these programs have uncovered many COVID cases that it could have turned into outbreaks had they not been caught. The school staff are doing a heroic job themselves, testing, reporting, and contacting families with instructions to keep the schools and the community safe while providing continuous open classroom. This is no easy feat, and hats off to the school staff. We now do have several outbreaks in our county. The county jail outbreak that I reported on last time actually did close out, but in the next week, a new person who was arrested brought in a case, and 4 others have since been identified in a small but significant outbreak. We have 2 skilled nursing facilities that are involved with outbreaks, and many state agencies, as well as ourselves locally, are assisting in efforts to control them. Round Valley continues to have more positive cases, and several tribal members, unfortunately, have passed away. I want to move on to new orders. At the last presentation, I planned orders for restaurants and bars requiring staff vaccination and verification of vaccination of patrons who wanted to eat inside. After the meeting I had with the business owners in Ukiah, I changed that order to strong recommendations, which were released this week. But also this week, I released an order requiring each business that serves food or alcoholic beverages to post, and let's have those slides up, in the front of their businesses, their level of compliance with those recommendations. I believe this transparency will give customers the freedom to decide how best to protect themselves. This week, I hope to see more people feeling safe and going out to eat in places that are safe. So these are the examples of our posters, and they'll be in the front of these establishments, and they are there in both English and Spanish. So in summary, COVID-19 Delta surge continues, nearly all among unvaccinated people. Recent data showed a Labor Day related increase in cases that may now be decreasing again. However, the aftermath of this past summer surge filled our hospitals and ICUs and cost many lives here. I hope that this experience with Labor Day will be an alert to our communities to plan carefully for Halloween, Thanksgiving, and Christmas, New Year's, which caused a terrible surge last winter we do not want to repeat. So there are differences from last year. We do have most of our community fully vaccinated, which is good, but there are still too many who have not taken the vaccine, and this is devastating for them as well as their loved ones and other contacts. So if you're not vaccinated, please get vaccinated soon. You are our priority. If you are vaccinated and have a moderate to severe immune deficiency, you could be eligible for a third shot, so contact your provider. When the CDPH decides on boosters, you will probably be eligible if you have had a Pfizer vaccine more than 6 months ago, if you're over 65-year-old or over 50 years old with either underlying conditions or occupational exposures. So please get vaccinated. They are safe and they are effective. They will let us travel, enjoy ourselves, and get back to normal. In the meantime, remember the non-pharmacologic interventions. Most importantly, if you have symptoms, stay home. Get tested. Don't pass it around to your coworkers or the rest of the community. Follow the isolation and quarantine recommendations for you which will be given to you by the contact investigation, contact tracing team. This will protect you and your family and community, and there may be services you're eligible for. Wear masks indoors in public places and outdoors in crowds, except while actively eating or drinking. If you go out to eat, keep your mask on except when you're actively eating or drinking. And increase ventilation indoors and spend more time outdoors. Keep your distances from non-household members whenever possible, both inside and outside. Remember hand hygiene with soap and water or hand sanitizer. And for gatherings, especially coming up this fall, remember that they are higher risk. We want you to use good sense. It's an individual choice. Try to be safer, and it will be much safer if everybody who participates is vaccinated. Avoid large gatherings and plan now for a healthier, safer fall and winter celebrations. And for that, stay well and stay safe, and I'll be here for any questions.
Thank you, Dr. Coren. First question is going to come from Kate Maxwell with Mendocino Voice.
Hi, thanks. So I was wondering if Dr. Coren could talk a little bit more about the timing for the signage order. And, that's supposed to go into effect on November 1. If that's sort of based around giving businesses time, or if there's any consideration of that being expanded to other industries at all. It seems like there's still about 5 weeks till that would go into place. So I'm just wondering at what point, that seems like quite a while before people will have that information as they're making choices over the next month.
Well, we wanted to give the businesses and their employees a chance to get vaccinated, and we want the community to get vaccinated. We did want to make it mandatory that the posting goes up before Thanksgiving and the winter holidays. So that's the time at this point. There was evidence and data behind doing this for the restaurant and bar industry. That evidence does not extend to other industries, and I'd rather not be generalizing what's needed to keep our community safe, because there are downside consequences to that. So at this point, that's the group that we've aimed it at and the reason why we delayed.
Okay, thanks. Should I ask a second question now, or did you want to rotate?
Sure, you can ask your follow-up.
So I was wondering if you could talk a little bit more about foreseeing testing availability and moving forward. I know that involves a lot of different partners, on the county level and the clinics and the different testing facilities. But, as you've been giving updates in these other presentations, and there's been discussion of a potential testing shortage, If you could just talk a little bit about what people could expect in the next month around testing and how they could best be following these guidelines if there's kind of some testing shortages happening.
The only shortage that's really happening is the use of Binax now. That's become a real scarce resource, and Abbott is putting them online, and we're starting to see a trickle in to the state of more of these. Because they're scarce, we are targeting the schools for continuing use of them. In the meantime, another test, a rapid test that's coming online to support and replace them if needed, is called Care Start. It's a little bit different chemistry, but the results are ready again in under 15 minutes. It has a little bit different reporting program. So as soon as that is available, and it is, if people go to the Testing Task Force website, they can begin to order that and get online for those. That's for the rapid tests. And that might be used for businesses or other groups. EMTs, fire, law may require that. As far as the testing in the county that we do with PCR tests, there isn't a shortage of them. In fact, what has happened is that we have a lot of that available now. And in the county, what we are exceeding the state's expectations in terms of offering, and not only offering, but obtaining testing in our county, which is very good. It helps us, control outbreaks before they happen. So what happened this week was a lot of mixing up on the part of the state contractor. In fact, we continue to, of course, offer testing at the fairgrounds 7 days a week, and we have had a travel team for many months. And with some discussions with the state LHI, an added minibus was contracted for, but there was a lot of mix-ups. I think they missed on Monday, and they weren't in Fort Bragg on another day. This has been a very troublesome week, but our county has been on the phone with the state and LHI, the contractor, and I believe that this coming week it's going to be much more successful, and there'll be adequate testing opportunities for PCR in all of the towns and the cities in Mendocino County.
All right, next up, we're going to have Danilo Sands with Mendocino Action News.
Good afternoon. Can you hear me?
Yes.
Okay. Thank you for the meeting. One of our members has asked the question regarding mental health. I know that you went over this before, and we talked a lot about this in the beginning. The first year of the pandemic, we saw a rise in suicides, according to the sheriff. How has this been going since then, since all the changes that are related to the pandemic, loss of work, loss of social interaction, and so on? Are we still seeing a rise, and are there a lot of resources for them, for mental health?
I do not have updated data to answer that, but I know that there has continued to be an increase in mental health problems, including drug use and suicides. So that is something that's, I don't have new data to support that. Our Department of Behavioral Health is doing quite a bit with their own clientele, but also from a public information point of view. So that's as much information as I have on that now.
Thank you. Is there a way that we can include that in an update in the future to have them join?
I will certainly register that. Yes, that's a very good question.
Thank you.
Thank you.
You guys already answered that question. Okay, there still is a lot of confusion regarding the booster versus the third shot. And I know you just went on about the booster has not been approved yet. And you went into great detail about that, so thank you. But can you explain the difference between the booster and the third shot?
I will try. It's not so easy. I'm glad you got the terminology down, though. One is a third shot, the other is the booster. So the third shot has been offered, and it is the same the same exact vaccine as the first 2 shots would have been for the mRNA vaccines. But in the last several months, it became apparent that certain groups of people have immune deficiencies and didn't get the same response to the initial series of 2 vaccines that we wanted or expected them to get. So for that group of people, we consider their vaccine initial series to be 3 shots. And so that's why we call this a 3rd shot, but it's for those people who have immune compromise and didn't have the same response, the best defense with the 2 vaccines. So that's the 3rd shot. Is that clear? Before I go on, is that clear?
For me, it is. Yes, thank you.
Okay, so we're trying to get people up to a baseline of immune response, and that immune response is a lot of different things. It's not just the immune globulins that you can test in the blood, but there are other things that are much more difficult to test. But they have been able to see that some people just don't mount the same response, even though we give them the vaccines. The next term is boosters. So for people who have had the 2 shots in the initial series and they've had a normal response, there is a concern, and this is, from other vaccines, that the efficacy of that response may be decreasing. So they may have had a great response, but now there's evidence of more infection in that group. With the COVID vaccines, we're really not seeing that with the most severe either symptoms or hospitalization, ICU, or death. We're just not seeing that. But we are seeing an increase in people getting mild to moderate diseases. And some people more than that, it maybe extend into the hospitalization group. And so for that group in general, for the ones who are the most vulnerable, we're saying, okay, maybe it's time to get a booster shot before we see a breakdown in the efficacy in the more serious infections. And so those shots are for people who we believe had a normal, appropriate, and effective immune response to the initial 2-dose series, but a 3rd dose will be useful for them because they have other vulnerabilities, including age, but also the others that I mentioned, or because they have other significant exposures or may transmit this new, more contagious Delta variant. So we're offering booster shots for that group. Does that clarify it?
It did. Thank you very much.
Okay, great.
And I can just jump in a little bit on the behavioral health and recovery services. On our website, we also have some BHRS services. So I'll just share what that looks like briefly. This is the Mendocino County's website. I just clicked on it's a little bit of a hassle. Government, health and human services, and then behavioral health services, and that brings it here. But we've got the crisis line and then the warm line that are both accessible on our website. And I'll leave those up for a moment if anybody wants to copy down that information. All right.
Thank you.
Thank you, Kirk. Next up is going to be Sarah Reith with KZUX&Z.
Hi, thank you. Can you hear me?
Yes.
Yes.
Hi. So you mentioned at the beginning that we're not really doing great in relation to the rest of the state. And I'm wondering if there are policy fixes that could be undertaken to address that. If there's anybody in any other part of the state who's doing something that looks like it's working, and if we think that we could implement that to bring our numbers down.
One of the theories that we have had more illness in Northern California than the rest of California is because we didn't suffer as much during the winter surge. And so the immunity that comes from the illness may be at a lower level in Northern California. Other than that, as a policy issue or even a better understanding, I have not seen anything emerge in that way. The way to address it at this point is increasing vaccinations, and we're trying as hard as we can. And of course, identifying those people who there's a disparity in getting the vaccines out to. But those are the explanations that I've heard of as the reason why we are either behind the state or ahead of the state in terms of case numbers, whichever way you want to look at it.
I'm wondering if there's any consideration to toughen up on vaccine mandates. I know that you just talked about lessening the idea of vaccine mandate to a strong recommendation for restaurants, but I'm wondering if there's any kind of tougher thinking in the pipeline.
So of course, we could make a whole lot of recommendations, mandates. The problems are that it's not just, I'll use an analogy from my 45-year practice as a family practitioner. You know, you can make the best diagnosis and prescribe exactly the right medicine. And if people don't understand or don't follow your instructions, it doesn't cure the disease. And so in this situation with COVID, it's exactly the same thing. But the problem has also been politicizing the interventions that are really excellent that we already have. So as soon as we talk about masking, there's a certain group of people who don't want to mask. And as soon as we talk about vaccines, if we make it mandatory, there's protests that go on all over the place. And they bring along a lot of people who may not have the information, but they are also able to get frightened. And it's that fear of doing the appropriate interventions that I think is worse. And so what I'm trying to do is develop orders that bring along the whole community. And it's more than just medical indications. There is, I hate to say it, but there really is a bit of politics, understanding the sociology of the community, and we have a very mixed community. So that's why I backed off of the mandate for vaccines to enter restaurants or for the employees to be vaccinated. But I wanted it to be strong recommendations. And then I thought that it was very important that the populace know what is this establishment enforcing, and what is the safety of walking into that establishment. Like you would decide between two boxes of cereal. Does this have more protein or more sugar, or does that? And that's a consumer protection kind of mandate that I did. And so as time goes on, the state or the feds may have more mandates, but I think if I were to step way ahead of the state or ahead of what our community will listen to, I think it'll create more of a backlash that'll be more harmful to the community and will not bring more people along to understand what's needed and what can help them. Does that help answer the question, Sarah?
Yes, thank you.
All right, next up, we're going to take a couple questions from social media. The first question is, will kids have to have 2 doses like adults, or can they just have 1?
Good question. So at this point, the doses for the youngest kids, it looks like they will reduce the doses, but probably will continue to require 2 doses. And the reason for that is more biological. The initial dose primes the body to recognize the antigen or the offending agent. But the booster dose, or it's not the booster dose, the second dose in the series is able to accelerate that response and get a much bigger response of antibodies. So in some vaccines, we only have needed to use one dose, but so far, the way the technology is going and where we are in history, in the history of this disease, they are requiring 2 doses to get the immune response to be adequate.
Thank you, Dr. Coren. And the next one is going to be also, what resources are available for those with extreme anxiety about the vaccine or phobia of needles?
That's a good question. My recommendation is to seek out your own primary care provider to get the vaccine. I know in my office, when we had people who had extreme anxiety, we would have, family members right in there in the office with them. It would be either the nurse or MA that this particular patient trusted, or myself. We took a lot of time. We had people lying down so they could take the time to relax. Those would be some of the things that I would recommend.
Thank you, Dr. Coren. All right, Kate Maxwell, I'm gonna give it back to you with Mendocino Voice. Do you have any follow-up questions?
I guess I was wondering if Dr. Coren could give us a look at what he thinks might be the rate of new cases moving forward. You know, as we have these booster shots rolling out, what you anticipate the fall looking like here?
You know, there have been very many surprises all along, so I'm not so sure that my prediction is going to be followed very much, and I wouldn't put too much trust in it yet. I think that we will have surges after Halloween like we did last year, after Thanksgiving, and at the time of Christmas and New Year's. I hope that it will not flood our hospitals and intensive care units and emergency rooms like it did this past summer, and that may come true, that we'll be spared that terror if more and more people get vaccinated. And but I do think when these holidays come around, it's a time for gatherings, both formal and informal. People want to hang out together, and a lot of times there's a little bit more alcohol passed around, and people are a little looser. We make excuses for quote unquote bad behavior because it's time to party and have a good time. But those, you know, put us at risk and our loved ones at risk for the several weeks afterwards. So I think that if we can get our numbers way down now, we'll stand the best chance of weathering the surges that'll come from those holidays. And as I said during the presentation, I think now is a really good time to begin planning for Halloween in a way that can be done very safely. And we'll be passing out recommendations in that regard for the public to read. And I know our cities and other agencies, the schools, will also do that, especially for Halloween. We want to have people pay attention and make plans for Thanksgiving that are probably smaller gatherings and with all of the recommendations for the safest practices. And then again in Christmas and New Year's. I should add that if we do well with our vaccines, the projections by the modelers at CDPH is that we could get over this group that is now authorized or close to be authorized. For example, the children from 5 to 11 and the people with boosters. We could get over that somewhere around in February, and that would very much protect our community. Going forward, the 6 months to 5 years old may start in December, and then or may be approved in December, and then January we would start that. The point is that the more people there are who are vaccinated and protected, and the less there is transmission and disease, the less likelihood there is for another mutation or variant that could be. Delta was terribly contagious. The next variant could be more contagious, or it could also break through the vaccines and put us back to square one. And so those are all possibilities that we don't want to bank on, but they're there and we have to be careful. Now, the best way to avoid a variant is getting more people vaccinated so there's less transmission, less multiplication of these organisms, and less likelihood for a bad mutation to emerge.
Do you have a follow-up?
Not for that question, thanks.
Okay. Danila Sands with Mendocino Action News.
Hello again. Dr. Coren, you started to talk about schools and then you went into outbreaks and so on. Do we have an update since school reopened of how many cases we've had?
Reported or detected within the school, I believe the number is in the range of 25 for the county since the start of the schools. And these have been nipped in the bud. You know, when they walk in the door, they're tested, they're found, and they are either sent home, or now, of course, we have this modified quarantine where whole classrooms do not have to go home if it was a mask on mask exposure within school. And we are keeping the children in school, but after the school, they quarantine.
It seems like 25 might be a little low, but I mean, 25% like the first 2 weeks, I know. Is that, you mean current 25 cases or altogether?
Let me see.
And then is it true that if someone's testing at home or at OptumServe that they don't necessarily have to report that?
OptumServe does report it. We get those reports.
Okay, thank you.
Let me just check to see. So what I have down is 25 exposure events in total in my summary. Kirk, does that sound right to you?
Yeah.
Yeah.
Okay, thank you.
Well, thanks for your comment, because yes, it does seem like a lot more. And a lot of times we report on things or we're worried about things, the reality comes as a surprise. And we're really very happy that the measures we've taken this year have protected the children and in turn the rest of the community.
Thank you. Danilo, did you have a follow-up? I think that was 2 questions, but I just wanted to make sure.
I think it was.
Okay, cool. All right, and then Sarah Wright with KZX and Z. Is she still on the call? We might have lost her. All right. Either Kate or Danilo, did you have any follow-up questions before we wrap things up?
I do, but I was waiting for Mendo Voice to start.
Oh, go ahead. I'm having a, I'll go after you, Danilo. Hold on. I'm having a.
Is there any new variants to be of concern? That's my last question.
That's another good question. So there are variants that they're tracking and finding. Thankfully, none of the serious ones are in California, and very few are in the United States at this point. But yeah, they're emerging all the time, and that's why we do whole genome testing around the world, and especially in the United States, and then even more especially in California. But we're not seeing any that are taking hold. At this point, over 99% of the variants that are found in California are the Delta variant, which in my opinion is bad enough.
I guess my last question is about if you could give an overview for the industries that are required to do the vaccination and testing. I know there was a pretty lengthy discussion at the last Board of Supervisors meeting about how those efforts are going in terms of the percentage of employees in county departments specifically. But I know that is not necessarily all your purview, Dr. Coren, but I don't know if you have just a sense of an overview of those different partners and how that mandated vaccination process has been rolling out so far.
But primarily the mandates for vaccines and or testing involve the healthcare industry, hospitals, skilled nursing facilities, long-term care, clinics, and anywhere that healthcare is being practiced. The other group is within the schools, and the other group is within prisons, because they're congregate care facilities and homeless. And here in Mendocino County, and also in Sonoma County, as well as some other counties have followed, we have been requiring verification of vaccine, or if exempt, to be testing on a regular basis. The recommendation I made last month was for other industries to follow suit and require within their HR rules that they should be vaccinated or regularly tested. When I think that at the federal level, those people those companies that are over 100 employees are now required to either show verification of vaccine or testing.
Okay, thanks. I guess that I don't have a follow-up for that right now.
All right, thank you. That sums up today's COVID-19 update. Thank you for joining us. I'd like to give Dr. Coren an opportunity to give any concluding comments he might like to.
Well, let me just repeat that we are coming off a surge now, I believe, but we're going into another season where we could have easily another surge like we did last winter with all the holidays coming up. I really like, and I think all of us would like to not have that. The way to avoid that is with really making use of the vaccines. It is those people who are unvaccinated are getting the illness more, suffering from the illness more, but they are also harboring and transmitting the virus that we all suffer from most of all. And so really what I want to say is now is the time to get vaccinated. That is the way to protect ourselves, our community, and get a little back to normal so we can enjoy the holiday seasons. If not this year, then maybe in the winter after that, when we see the numbers really start falling. And that's what we're all hoping for. So I hope that you can either get vaccinated, or if you know someone who's not, convince them to get vaccinated, and otherwise use the non-pharmacologic interventions, plan your holiday events very carefully so they're not transmitting events. Otherwise, we'll see you next in 2 weeks. Stay well.
Thank you, Dr. Coren. Our next update will be scheduled for October 8th. Please continue to follow Mendocino County Public Health on Facebook for all your COVID-19 updates. Thank you for joining us, and I hope everyone has a safe and fun weekend. Thank you.
Thank you.